I'm Dr. Michael Brumfield. I'm a general surgeon here at Putnam County Hospital. I've been here for about 9 months so far. Our bodies need routine maintenance just like a car or any other piece of equipment, and routine colonoscopy is one of those necessary maintenance things. Colon cancer is the second leading cause of cancer death in the United States. More than 53,000 people will die from colon cancer every year. Of those people that died from colon cancer, 75% of those people were behind in getting their normal screening done. Either they hadn't done it at all, or instead of coming back in 5 years, they waited until it was 10 years or something similar. And then there's more than 150,000 new cases of colon cancer diagnosed in the United States every year. Pretty much everybody needs colonoscopy. Anybody that's 45 and over, up to about 75, assuming that everyone in your family that's old enough to have had a colonoscopy has had one, and nobody's had colon polyps, nobody's had colon cancer, you are all considered average risk and could have a colonoscopy every 10 years. If even one of you has had colon cancer or one of you gets one polyp, you and the immediate members of your family are considered high risk and would need one at least every 5 years. And then depending on what we find when we do your colonoscopy, you may need one a little more frequently, or at least need the next one a little bit sooner. Well, the prep that we use here is very gentle. Basically, you're getting a bottle of Miralax and a whole lot of Gatorade, and then a couple of Dulcolax tablets. And then you're washing that down with 64 ounces of Gatorade or something similar. The day before you come in, you take a couple more of the Dulcolax tablets, and that kind of helps get rid of anything that was left over from the night before that kind of trickled down. There's not usually any significant dietary changes prior to colonoscopy, other than, number one, being on clear liquids all day the day before, and then not eating or drinking anything after midnight. However, if people eat a lot of fruits and vegetables, I try to get them to back off on that for a couple of days before, because there's a lot of residual from that. There are adjustments that we usually need to make in medications that people take. Diabetic medications, we have you consult with your family physician. We cut your insulin in half because your sugar dropped too low. Any type of blood thinner, we have that held for several days. Procedure generally takes 45 minutes to an hour. That's all relative. And then, of course, if you have a lot of polyps, that's usually what takes more time. During the colonoscopy, you will be asleep. You will not be asleep enough that the machine would have to breathe for you like general anesthesia, but you will be completely asleep and comfortable. You won't feel any discomfort. You won't hear anything. So when you wake up from your colonoscopy, you're probably going to be a little bit groggy for a while, and that's normal. That's to be expected. We don't want you driving that day. You can't go to work that day. We don't want you to do anything important, signing any legal documents, anything like that, because you'll feel fine, but you won't be 100%. And then the following day, you can return to your normal activities. We generally tell people to start out with something really light to eat, at least for the first meal, like some soup or cream of wheat. If you're certainly having any kind of fevers, anything like that, or if you're just really not feeling well, I would much rather that you call my office or come to the emergency room if it's after hours. After your colonoscopy is finished, it takes about 2 weeks to get results back from you. If you're hesitant to have a colonoscopy because you've heard about bad experiences other people have had, I would encourage you to voice those concerns to myself or whoever you end up going to see, so that we can hopefully, first of all, dispel any myths and tell you how remote the possibility is that any of those things will happen. But first of all, if we catch it when it's a polyp, we can keep you from ever getting colon cancer, and just having peace of mind. Once you've had your colonoscopy done, let's say 3 months later, 6 months later, you're passing a lot of blood in your stool. That's certainly going to be something that we need to look into, but it's going to be highly unlikely that it's going to be cancer, because cancer doesn't grow that fast. Like I said, unless you have it when I first scope you, it's something that's 99% preventable.